Welcome to Be Well, a quarterly It's Okay podcast designed to promote and support mental, financial, physical, and social well-being. Be Well provides insights, tips, and strategies for enhancing all aspects of well-being through conversations with experts. Whether you want to manage stress, improve your financial health, boost your physical well-being, or enrich your social relationships, this podcast is a go-to resource.
Hello, everyone. Thank you for joining us today for a Be Well podcast. I have a very special guest here with us, Dr. Christopher Still, who is a professor of medicine at Geisinger Commonwealth School of Medicine and medical director for the Center for Nutrition and Weight Management, as well as the director at the Geisinger Obesity Institute. Chris, thank you so much for being with us today.
Hi, Bob. It's a pleasure to be with you all today.
Yeah, thank you. Would love to hear a little bit more about your background, and
Sure.
I understand you've been working on nutrition, metabolic syndrome, and obesity for nearly 3 decades now, and
Yeah.
would love to hear about that and why this line of work is so important to you.
Yeah, well, thanks. So I'm an internist by training. And actually, before medical school, I got my master's at Columbia University Institute of Human Nutrition, and worked in their Obesity Research Institute. So I've had a long personal uh, interest in nutrition and obesity. And then I went to medical school, did internal medicine, and then actually did a obesity medicine and nutrition support fellowship in 1995, so almost 30 years ago. So, who would have thought 30 years ago that obesity medicine and nutrition would be where it is today? But, I love what I have done, my profession. And, I always say, if you like what you do, you'll never work a day in your life. And my kids
Yeah.
always say, well, Dad, not everybody likes their job like you do. And I said, well, keep looking. But I've really been a great profession, and I love what I do. And I love to talk to patients and healthcare providers about obesity and its complications.
Yeah. Yeah, and forgot to introduce myself. So, corporate medical director for Cummins, and my background is family physician and occupational environmental medicine. And before that, I was a wellness coach,
Ah, great.
and so really developed a passion for healthy lifestyles, for coaching, and a lot of people during your 30s and 40s, most people are concerned about being at a healthy weight and having those healthy habits for preparing for the future, and so for me, really picked up a passion for that with wellness coaching for that.
That's
Um,
great. What a great background.
yeah, thank you. You mentioned, so 30 years ago is when you went through that training, and a lot changes over time, and a lot stays the same. Could you tell us a little bit more about kind of the current state of what you're seeing as far as what concerns are out there for you when you're thinking about healthy weight management and how obesity affects us?
Yeah. So one thing has just changed is the epidemic of obesity and patients that are overweight and have obesity. 30 years ago, it was a problem, but it wasn't a problem like it is now. And it affects all of us. We look at the studies now, and 70% of us are overweight, and 40% of us have diagnosis of obesity. And really, what I like to explain that it is a disease like any other disease. It's not a lack of willpower. It's not somebody's fault. That we all struggle sometimes in our life, either ourselves or family or somebody that we know. So I think that although we have a long way to go with stigma, I think we're finally understanding that obesity is a disease and there are treatments. 30 years ago, there really wasn't any treatments, and we all hear about all the new medications that we'll talk about in a little bit. But, I just think it's been a perfect world, if you will, for cardiometabolic disease, that we understand it better and there's more safe and effective treatment.
Yeah, thank you. I think that's very helpful for people to hear, right? Being that there is hope. There are
Oh, yeah.
great treatments out there. And a lot of people are very successful at either maintaining weight or losing weight. Um,
Bob, what you asked and I didn't answer, but what has stayed the same? There's a lot of new treatments, and there's medications and surgery that are very, very effective. But the bottom line is nutrition. I don't like the word diet, but that's basically what it is. Good nutrition and exercise, really have to be the cornerstone to any adjunctive or any other treatments that we add to that. That really hasn't changed in 30 years, which is good. And that's where, I think the health coaching and dietitians and just being accountable, that really has not changed.
yeah, thank you, and would love to talk a bit more about that. So, could you tell us a bit about the role of exercise and physical activity when it comes to weight management?
Yeah, so exercise is key. Exercise means different things to different people. I like just to think of decreasing sedentariness and increasing activity, whether that's going to the gym, going for a walk, not getting up from your desk during the day. But we know that exercise in and of itself is not that effective for weight loss. However, it is crucial for weight maintenance. So however we lose the weight, and we can talk about different roles of weight loss, because we decrease our lean body mass with any type of weight loss, exercise is really crucial to maintain that lean body mass, that muscle mass, because that's what maintains our metabolism. And so, there's different recommendations. Some of them are very unrealistic, in my opinion. But I think for someone just starting out, we try to have a goal of just 30 minutes of quote unquote exercise over a 24-hour period. You do not need to do 30 minutes all at once. Most of us can't do 30 minutes all at once. But I like to look at more of an occurrence type of exercise. So if you can do 5 minutes 6 times a day or 10 minutes 3 times a day, anything you can do to get your heart rate up, breathe hard, and break a brow sweat, that's great. And that's really what we're looking for. So you don't have to join a gym. You don't have to, buy an exercise, equipment that we rarely use when we buy it. It's just decreasing sedentariness, but it is very important for weight maintenance.
Do you mind if I ask if you have a preferred exercise that you do that you like to squeeze in to keep up with your 30 minutes?
Well, I usually do a treadmill and I play tennis and pickleball, but I try to do something every day. But like I said, I worked up on this treadmill. I do about 30 minutes, but it's taken me a long time to work up to that. But like I said, anything that you're going to do is good physical activity, because what I do may not be what you like to do, and what you do, I can't do, I'm sure. So I hate to set people up to fail. And the other thing is that what I've learned is when you say you have to do 30 minutes and you say, okay, I'm going to get up 30 minutes early tomorrow to do exercise. Mm-hmm. And your alarm doesn't go off and you sleep in, you're like, well, I can't do it today, I'll do it tomorrow. But if you could just do 5 minutes that morning and then 6 times 5 minutes, you got your 30 minutes in.
Yeah. No, I think that's great. And it reminds me of, the thought that the best vegetable for you is the one that you actually will eat, right? Yeah. The one you enjoy.
Same thing with diet. Same thing with the diet.
Yeah. Well, let's talk about that now. So interested to know kind of the same thing as far as, what should we be thinking about the role of food and nutrition when it comes to weight management?
Yeah, so that's a little trickier because there's no one diet that is best. I mean, everyone's looked at high-fat diets, low-fat diets, all these different diets. And really, at the end of the study, there's really no difference in weight loss between high-fat diets, low-fat diets, intermittent fasting, ketogenic diets. But the key is, and you hit it on the head with exercise or the vegetable, whatever you're going to stick to or adhere to, that's the best diet for you. I will say, however, there is a physiologic reason behind the Mediterranean type diet, if you will. So there's 2 different types of body habitus, how we carry our weight. And we've heard this for years, the apple versus the pear. And waist circumference is a really good determinant of that. So if your waist circumference in women is greater than 35 or in men greater than 40, then we kind of have that apple-shaped type distribution or more visceral adipose tissue. And that can be worse for us because that's around our vital organ and it's more metabolically active, and there's more risk of developing diabetes and sleep apnea and fatty liver disease and high blood pressure. But that type of weight distribution may be more amenable, or the Mediterranean type diet may be better, quote unquote, better in those types of patients that carry their weight through their midsection. So basically, it's just trying to increase your lean meats and proteins, fruits and vegetables, and try to decrease your breads, pastas, rice, potatoes, corn, and cereal. It's not low carbohydrates because you're getting plenty of carbohydrates in your fruits and vegetables, but it's not just all low fat starches and breads and pasta, which is all low fat, but they can increase blood sugar and insulin and put on weight through your midsection. Does that make sense?
Yeah, that makes sense. And thinking about finding what works best for people. There are a lot of fad diets out there. A lot of things come and go. Some can be very helpful. They can be motivating. Others potentially harmful. Or some. Any advice on how people can navigate and ride the wave for something that's motivating, but potentially avoid something that may not be as helpful?
Yeah, so there's really no quote unquote harmful, unless you get into like the very low calorie diets that you're really just not eating enough and not getting enough nutrients in. That would be harmful. And to be honest with you, those don't work at the end of the day anyhow. I mean, you're going to lose weight in the beginning, but 95% of those patients go on very low calorie diets, gain back their weight and more, actually, from a variety of biological and hormonal changes that occur with that rapid weight loss and weight regain. So I think it gets back to what is going to fit in your life for the long haul. There's no quick fix. We should think of this as a marathon more than a sprint, and you don't have to make big changes overnight. And really, what I like to do is see how many calories someone is taking in without any changes. Say it's 1,700 calories. Then you want to try to reduce by 500 calories a day. Not eat just 500 calories, but reduce your calories by 500 calories. That is 500 calories a day times 7 days a week, 3,500 calories. That's going to promote about a pound a week or 4 pounds a month. That's the type of weight loss we want to try to achieve, because that's the weight loss that's been shown to be much more long-term than a drastic change that we can lose weight, but then we tend to gain back weight. So modest decrease in calories. We have to decrease calories, but modestly, and make changes that we're going to try to stick to for the long haul.
Yeah. So I think, and you touched on something that I'm sure people have a lot of questions about, but it's reasonable expectations for weight loss. So it sounds like you said about a pound a week, or pounds a month. What do you think, as far as if someone is interested in losing weight, what longer term target would you kind of set up with someone to get to a meaningful weight loss that where they can feel the difference?
Everybody has unrealistic expectations with regards to weight loss, and I'll just put some expectations out there. On average, with diet and exercise, patients can lose about 3 to 6% of their weight and keep it off, which is not bad. There's a lot of medical benefits with 3 to 6%. Glycemic blood sugar control. For every pound we take off, takes 5.4 pounds per square inch on our knees and joints. Just a modest weight loss has helpful with obstructive sleep apnea, fatty liver disease. But it is clear that the greater the weight loss, the greater the benefit. So if we're looking at losing more than, say, 3 to 6%, and like I said, some people lose a lot more with diet and exercise, some people lose less. But if we're looking at losing more or wanting to lose more than that, then we may need to look at anti-obesity medications and or bariatric surgery, because that's really, then you get into the greater weight loss with better resolution or control of a lot of medical problems. So it really, I think you have to look at the patient and quote unquote how sick they are, meaning how many medical problems they have, is maybe more how aggressive you want to be with regards to how much weight loss. Does that make sense? Because the more weight loss definitely has greater benefit on medical problems, but you don't have to lose 100 pounds to have significant medical benefits.
Yeah, that makes a lot of sense. And and so you had touched on some of those other treatments that are available. And so, bariatric surgery, there's a number of medications out there. Can you talk a bit on those as far as what role they play,
Yeah.
in addition to those lifestyle type
Yeah, I
changes?
just want to touch on two other lifestyle things with regards to diet and exercise that are what I think what we can try to do, and then move on to medications that are surgery. So we talked about what diet, how many calories to reduce, exercise. The other thing I think is really important is to try to avoid regular sodas, fruit juices, and caloric beverages, because people can drink thousands of calories a week and not think anything of it. They drink a lot of orange juice, or they go to their coffee place and get like a coffee that looks like a milkshake. There's a lot of calories in those, and at the end of the day, they just increase blood sugar and increase insulin, and people don't really think about alcohol is another thing. We don't think of calories, but that's something that I think is important, that if we can just try to avoid drinking regular sodas, fruit juices, and caloric beverages and go to diet or water, 64 ounces of water a day has been shown to help maintain that rate of lipolysis or fat breakdown. And then the last thing is trying to be accountable, whether it's to an app to count calories, getting weighed on a regular basis, going to a health coach on a regular basis, because the more we can be accountable, the better we're going to be. So those are sort of the pillars of lifestyle modification that we try to go through. And then we talk about, medications and or bariatric surgery.
Yeah, perfect. Yeah. Thank you for bringing those up as well. Here's a visual we have
Yeah,
for
perfect. That's good.
32 ounces.
Yep.
So two of these.
2 a day. Yeah.
Yep.
And that has, like I said, because when we reduce our calories, our body doesn't know why we're reducing calories. It thinks we're going into a starvation, quote unquote, starvation state. So it will conserve its fat stores. So by drinking the water, it replenishes our blood volume, and actually it allows our liver, which break down fat, to break down fat at a regular basis. So that's why water intake is important.
Perfect. Yeah. So thank you for walking us through those, and maybe we can kind of split it into two parts, so we can talk about medications
Yep.
and then can talk about bariatric
So
surgery.
medications are recommended, or approved, I should say, for someone with a body mass index of 27 and one medical problem, such as diabetes, sleep apnea, fatty liver disease, high blood pressure, or a body mass index of 30 alone. So that's what the FDA has approved. Some insurances have their own criteria, but that's generally what is approved for medications. Been a long history of medications going back to the 1990s. You may remember fen-phen, and they had some fenfluramine, had some heart problems. It was taken off the market. There's some very effective oral medications. They're called Qsymia and Contrave and phentermine. But most patients now, or most people, are hearing about the new shots, the injectables. These are the GLP-1s and the GIP combinations. So they're the Wegovy's and the Zepbound, the Ozempic. So this is really the newest generation. And this has really been a transformation, if you will, for cardiometabolic health, for diabetes, for weight management, cardiovascular disease. They've been shown to help decrease risk of cardiovascular events. They've been shown to help with patients with obstructive sleep apnea, with chronic kidney disease. So they really have been a game changer with regards to weight loss in this cardiometabolic space. But, everything has risks and benefits. And so one thing about these medications, the class, the GLP-1s, the injectables, If you have a rare form of thyroid cancer called medullary thyroid cancer, or if you have a history of pancreatitis and you're not sure why you got pancreatitis, those are really two contraindications that you should not take those medications. And you can talk to your healthcare provider about that. But in general, those are the two reasons why you shouldn't take it. Now, there's side effects too. There's side effects of those medications, even though they're very, very effective. The most common side effects are GI related. So nausea, constipation, some people get diarrhea, some people get worsening of acid reflux. And so that's why with those medications, we start at a very small dose and then we escalate up. And we know that the slower we go, it can help mitigate or lessen those side effects. But the biggest thing I want to make sure people realize is that they're very effective. We can get weight loss into the 16, 17, even 20% weight loss in some people with us. But once you stop them, and if you stop them acutely, say you change insurance or you can't tolerate those, all the studies, it doesn't matter what medication you're on, has been shown that 2/3 the amount of patients will regain their weight back within 1 year. So when you're thinking about these medications, which are very effective, you really want to think of them like any other chronic disease management. So once you start them, you want to continue them, because once you stop them, like I said, chances are you're going to regain your weight. I am biased, but I think of obesity treatment like I treat any other chronic disease. If you're diabetic and you're on a medication to treat your blood sugar, and you get your blood sugar down to normal, you don't stop the medication or your blood sugar is going to go back up. Same thing with blood pressure or heart failure. So I think the model is correct, but a lot of payers and physicians and healthcare providers don't see it that way. So because then patients just go through that whole exercise and spend the expense and all that and side effects for nothing, because 2/3 will regain their weight. But they are very, very effective for not only losing weight, but as I said, helping control other medical problems.
Yeah, I think that's a very good call out as far as, when you do hear so much out there about these new medications
Every day.
And one of the drawbacks that they're putting out there is that you have to keep taking it.
Yeah.
And it's a really good call out to remember we also need to continue to take our vegetables and continue to exercise, and so there are those things. And then with other medication, right, it's relatively normal to have a medication that you do need to take on the long term to continue to get those benefits.
Yeah, two good points, because hopefully with regards to medications, if you take this medication, maybe you can decrease your blood pressure medication or your diabetes medication or other medications. So that's a good thing. But you brought up a great point on diet quality, because these medications are very effective in reducing weight and decreasing our appetite. But we want to make sure patients are getting enough to eat, getting enough protein, getting enough vegetables, not micro and macronutrients. And so we always work with health coaches or dietitians, really not to say, oh, you shouldn't eat that or don't eat that, but are you getting enough in, and are you getting enough vitamins and minerals and things like that? So that's a big change that we, with these medications, that we really never, our whole counseling and dynamics has changed because of the efficacy of these medications.
Yeah. And then did you want to comment at all, or any thoughts around bariatric surgery?
Mm-hmm. Bariatric surgery is a very beneficial treatment modality. It is the most effective treatment for the treatment of obesity and its comorbid medical problems. There's indications, just like the medication indications. The indications for bariatric surgery is a body mass index of 35 with a comorbidity, such as diabetes, hypertension, obstructive sleep apnea, or a body mass index of 40 alone. We do a lot of bariatric surgery here at Geisinger. We do a lot of gastric bypass. The two most common that you'll hear about is the sleeve gastrectomy and the gastric bypass. We do a lot of gastric bypass just because as a whole, that's the procedure that has been shown to help the medical problems greater. but sleeve gastrectomies are the number one performed surgery in the country, actually the world. So it's just what your patient population. What I would say is if you're considering bariatric surgery, talk to your healthcare provider and make sure you're referred to a center of excellence because they have the highest volume and the best outcomes. So that's it's very safe. 99% are done laparoscopically, or what we call minimally invasive, just with the 5 incisions. And most patients go home the next day. But it is a surgery. And really, again, I'll go back to risk stratification. What's your BMI and what medical problems do you have may warrant consideration for bariatric surgery.
Yeah, perfect. Thank you for all your comments and all your advice. Thinking about what would be some final recommendations you would make for someone who's interested in maintaining weight loss or maintaining weight or losing weight.
2 things: have realistic expectations, because as I said, everybody wants to lose 100 pounds or whatever. And you can have that as a goal, but take 10% increments. Reach that 10%, congratulate yourself, and then go on to the next 10%. So your goal may be 40% weight loss, but take 10% increments. And the other thing I would say, it is not your fault. We know this more and more now. Obesity is a chronic relapsing disease. And the earlier you can realize, or your provider, somebody can realize that it is not your fault, it's not a lack of willpower. And the good news is that we said there's safe and effective treatment, but all of them should be as adjunct to diet, exercise, and behavior modification.
I know that you've done some work with an organization called Obesity Action Coalition, and I'm wondering if you could tell us a bit more about that. And it seems like there are some great resources there that could really help people. So if you could expand on that as well, that'd be great.
Yeah, Bob, I'm so glad you brought that up. So there's a lot of different information out there. And the Obesity Action Coalition, the OAC, has done 20 years of advocating for patients with overweight and obesity. For full disclosure, I was one of the founding board members of that 20 years ago. But they have just so many resources, as you said, on all aspects of stigma, on exercise, on diet, on medication, surgery. And it's all geared to make the patients the center and advocate for them. And it's excellent, up-to-date, state-of-the-art information. And so I would definitely, there's a lot of information, as I said, I would start there first. And you'll see how much vast information they have to make you most successful in your weight loss journey.
Yeah, fantastic. Thank you. And yeah, I'm very passionate in this area, and everything I've clicked through there so far has just appeared to be excellent. Just high quality. What's the word I'm looking for? The equivalent of nutrient dense, right? It is a great concentration,
Yeah.
right, of the right stuff. And so we will include a link with this podcast for people to be able to click on that and check out those resources.
Terrific. I think you'll be very happy.
Fantastic. Thank you so much, Chris, for your time, and thank you everyone for listening. Yeah, thank you. And thank you everyone for listening in for our Be Well podcast. And yeah, Dr. Christopher Still, thank you so much. And have a great day.
Thank you. Thank you, everyone.
For more information on healthy weight management, visit the Obesity Action Coalition website at www.obesityaction.org.